What is the difference between a physician, a nurse practitioner, also referred to as an NP, and a physician assistant, also referred as a PA? You may also hear mid-level providers or advanced practice providers used as a term, which typically refers to NPs and PAs, just in case you hear that when you're out and about. This creates such a blur for so many people nowadays because both physicians and providers wear long white coats and stethoscopes. The reality is that although we work as a team, our expertise and training is very different. Hopefully, after today, you will get a better understanding. So, I think the main similar thing among these three are that they all need a bachelor's degree to do any of them. Okay. Now, as far as the differences, so for physicians, you need a Bachelor of Science or Bachelor of Arts degree, which is a BS or BA in any major. But you need to complete the pre-med course requirements, as we have discussed many times in our previous episodes, which include like chem, OChem, biophysics, math. And then the amount of time it takes to complete this, of course, is 4 years at a minimum to complete getting a BA or a BS. Undergraduate online degrees is likely not an option for physicians. Now, in regards to the nurse practitioners, they need a Bachelor of Science in Nursing. It's called a BSN, and that could be done online or in person or a combination of both. The required courses for the nurse practitioners are like human anatomy, human physiology, microbiome, general chem, statistics and pharmacology, and then also depending on the program, there might be nursing specific courses as well. So again, it depends on which school you go to if you need additional courses. And the other thing too with nurse practitioners, they must be a registered nurse, an RN. And then the timing to do the undergraduate part, it really depends on the school and which route the students take. So there's a traditional BSN program, and that is usually about 4 years to get this degree at a 4-year university or college. The other route is the RN to BSN program, and this is typically a 2-year program, since to do this program, a student must already be an RN. And then another route that can be taken by students is the accelerated BSN program. This is for people who have an undergraduate degree in some other major, and these programs will last somewhere between 11 to 18 months. Now, moving on to physician assistants, they need a bachelor's degree in any major. And then depending on the PA school of interest, you may not be able to complete your bachelor's degree online. So this one it just depends which school you're looking into. And then as far as required courses for undergraduate degree, it would be biology, general chem, human anatomy, physiology, microbiome, and math. So there are some requirements there for you to even apply to a PA program. And typically to complete the undergraduate degree is also at least 4 years, just similar to like trying to apply to medical school.
There's a huge difference in the clinical training hours required to be a physician versus a PA versus a nurse practitioner. So think about it. An NP, you only are required to have 500 clinical hours to start practicing as a nurse practitioner. Whereas for a physician, it's 15,000 hours. Now, PAs are somewhere in the middle there. So that's a huge, huge difference. So can you imagine how confident would you feel seeing patients and practicing medicine with only 500 clinical hours versus 15,000? So that's really something to consider. But honestly, the degree of confidence that you will feel seeing patients as a physician is a lot higher than the degree of confidence and expertise you're going to have right after finishing school as a nurse practitioner.